Now tell me if this sounds like you. I get this nagging pain above my ears, right at my temple, sometimes in my eye and eyebrow. Well, you boy or girlie, you have tension headaches, and I'm here to show you how to stop getting tension headaches for good. How's it going, everyone? George here from Vivir Wellness, and I help active, busy, high-level professionals achieve a pain-free lifestyle faster through in-home massage therapy services and educational videos on muscle and joint health. And today we're talking about how to stop getting tension headaches for good. Let's get right into it. When it comes to improving your tension headaches, you have to start with your ergonomics. Ergonomics being a major cause of tension headache symptoms, we have to address it before we do anything else. So start by improving your sleep ergonomics. Especially if you're a side sleeper, you have to make sure your pillow is not too low, so one side's getting thoroughly compressed, the other side's getting thoroughly stretched. If you're a back sleeper, you need to overhaul it altogether, because having your head turned to one side all evening is going to just cause that to become a jumbled mess. At your work setup and everything, make sure your laptop's not too high, not too low. If it's too low, we're now stretching everything in the back of our neck for multiple hours at a time. If it's too high, we're adding in more compression. If your desk height is too high, your traps are activated the whole day. You need to just make these little fine tunings, which is going to come with some trial and error, but it's overall going to set you up long term for a massive course correction. And your overall posture, where you're standing and walking and everything, that'll come with a lot of back strengthening. It'll come with some flexibility and mobility work to make sure all the muscles of your thoracic spine, your cervical spine, and your shoulder complex, they're well developed, they have a lot of circulation, and they developed a lot of tissue resiliency so you don't get these symptoms as easily. One of the simplest things that you can do to reduce tension headaches is to improve your hydration. So many people miss this, and it is the simplest thing that you can start doing today to get instantaneous relief. One of the main symptoms when it comes to dehydration is headaches. It is simple as that, but I know what you're thinking. Oh, George, I already drink plenty of water. Well, water isn't the issue. It's your electrochemical balance between the water and electrolyte concentration in your intra and extracellular space in your muscles. If you're just consistently drinking a lot of water, but let's say you sweat a lot, or you drink a lot of alcohol, or you maybe have some adverse social habits, you are losing and peeing out a lot of your electrolytes. When that electrochemical gradient is out of sync, it can lead to more exacerbated symptoms because your muscles are not functioning properly. Easiest thing you can do is get a hydration stick, Pedialyte, a Gatorade, and that'll help correct a lot of it, because you're rehydrating properly. You're covering all your bases in terms of electrolyte replenishment and having enough water. One of the most overlooked things when it comes to reducing your tension headaches is actually strengthening your neck muscles. Now, I know how many people actually train their neck. Very few people outside of pro combat sport athletes. You don't have to be Mike Tyson doing neck bridges, but a couple of sets, a couple times a week of reverse and forward neck crunches won't build a super thick neck, but it will get a lot of circulation and a lot of stimulation to those muscle fibers there, because if they're weak, they're far more likely to aggravate and cause symptoms, which can cause referral pain, which then causes your tension headache symptoms. If these are muscles you've never trained before, you're actually going to build them up pretty quickly, because just an introduction of a stimulus there is going to develop your muscle fibers. And when you develop your muscle fibers, they have more resiliency, they have more circulation, and guess what? They're less injury prone. So 3 times a week for like the first month of doing a couple sets of forward and reverse neck crunches will probably do wonders for your tension headaches. Now, this component when it comes to relieving your tension headaches is what everyone focuses on, but I'm going to make it as streamlined as possible, and that is to self-release and stretch your neck muscles. You're going to need to open up those muscles. If they have been tight and overworked and underdeveloped for quite some time, you're going to need some relief so we can set up everything properly. The easiest things that you can do for self-releasing them, get one of these plastic boards that you can lay on, place them on the base of your skull, hold it in a spot that gives you some discomfort. 6 out of 10 on a pain scale is fantastic. You're in the sweet spot there, and then move down your neck. Release your suboccipital so you can extend and rotate your neck, because that's where the majority of our movement comes from. Do the same thing for your traps, for your rhomboids. This is going to lay the foundation for the next thing we're going to do is to do some stretches for your neck to open up and lengthen that tissue. It'll also make some of the strengthening that we recommend that much more effective, because we like to follow a principle of let's get you as much range of motion and flexibility as possible in a muscle within your body's limits before we start adding in strength so we can cover all our bases. One of my favorite stretches for the neck is a combination of this chicken wing neck stretch. It's not the technical term. This is the one I'm going to use, where it's not only going to target traps, your scalenes, but also your SCM muscle at the front of the neck, and then doing the classic chin tucks. But the majority of of chin tucks out there really suck because they just really target just the center, where most of your suboccipitals, they're on, more of them are on both sides of your cervical spine than the center. So what I like to do is to add a rotation into it about 45 degrees, really make a double chin and bring the chin to the chest as far as you can comfortably. With every stretch, you should have a slight bit of discomfort, no more than a 5-6 out of 10. And you're gonna hold this for about 30 seconds to 1 minute, repeating about 3 times per side, and doing it a couple times per day for the first couple of weeks to provide a lot of relief to your neck muscles. Now, if you're somebody who's dealing with consistent muscle and joint pain and you feel super stuck or your results have plateaued, and you feel like there's no good free resources out there, well, I have you covered on a free guide that I wrote that's linked down in the description about the 10 hidden causes of your muscle and joint pain and how to fix them for good. And there you all have it. That is how to stop getting tension headaches, by what's causing them, how to improve your ergonomics, your hydration, strengthening your neck muscles, self-release, and stretching them. It's probably the most comprehensive guide out there when it comes to tension headaches. So if you did find this helpful, be sure to drop a like, comment your thoughts and opinions down below, and be sure to subscribe for more massage therapy and muscle and joint health content like this. Thank you all so much for watching, and I hope to see you all in the next video.